is, as Jonathan said, oxytocin as an antidote to stress. And just to tell you that there was one picture that Mechthild was showing that I hope you can send to me, the one by Crosshaus, with all the interactions within the stress system, localizing the noradrenergic system and the interference with the CRF systems, because I can already tell you there is no point in that picture that is not reached by the oxytocin nerves. So I think that what I'm going to try to show you is that oxytocin has been a hidden system because it's so broadly spread and there are so many effects acting at the same time. So it's very difficult to say, well, oxytocin is acting there and that's why we don't have any stress levels. It's acting as a network, sort of influencing many things at the same time. So you have to see the whole picture to understand how important it is. And also, I would like to tell you immediately also that there are so many misleading studies because people have measured oxytocin levels and they have used techniques that don't measure oxytocin or measure things that are not oxytocin, which makes it very difficult to interpret the literature. But let's start. So again, going back to the former presentations, of course, we have discussed now in a way the fight-flight response. I mean, the integrated stress responses that the body has. And this has been known for ages, but it's been less known, I would say, that we have an opposite pattern of effects, which I try to call the common connection response. But it really means that in this situation, if you look at this one and compare with this one, it's opposite on every level. The psyche is opposite, the physiological function is opposite. And as we know that the fight-flight response is governed by the noradrenergic and the CRF systems, there is every reason to believe that there should be a central basic system that sort of shifts the function into this position. Now, if we look at the stress system, this is just repeating what Mechthild and Jonathan have said, that there are two axes, the HPA axis and the sympathetic nervous system. And they are partly acting, they're activated by different things, but there are some aspects of its function that are activated together. And we look at that. Now, look at the HPA axis. We have the release of CRF from the listen, paraventricular nucleus, that is the site of oxytocin release, down to the anterior pituitary, and then ACTH to the adrenal gland. And then, as Jonathan really has sort of pointed out all the time, we have this enormous feedback system by cortisol acting on all of the different places where the different parts of this HPA axis. And in addition, in some areas in the brain, of course, where we have, where so the HPA axis is influenced. So this is a more straight line showing how the hypothalamus, anterior pituitary, adrenal axis is involved in the HPA axis. And then, of course, we have to mention that we have some areas in the brain which modulate CRF secretion or the activity in the stress axis. For example, the hippocampus and also some areas in the cortex. I'll come back to that. In addition, of course, we have the sympathetic nervous system, the autonomic nervous system, which is part then of the stress axis. Now, what about the oxytocin and common connection system? What is the organization behind this? Well, just starting with it's not, cortisol is a steroid hormone. It's a hormone that is built on lipids, and therefore it can penetrate membranes, it can go from the blood to the brain, and it's very can be widely distributed. Oxytocin is a peptide, it's a small peptide, But the important thing, it's a peptide, and peptides don't pass membranes like the blood-brain barrier or the GI mucosa to be absorbed. So when oxytocin works, it has had to develop other connections, other types of connections. Now, if we just sort of remember, oxytocin started to be the hormone that induces milk ejection and stimulate uterine contractions as a hormone. Unfortunately, I think that these original findings has slowed down the development of the oxytocin knowledge, because it was sort of, considered as a female hormone and put, aside really, and was not sort of investigated further for a very, very long time. But then look, where is oxytocin produced then? That's another very interesting thing, because there are really only two big nuclei in the brain that produce oxytocin, and that is the supraoptical and the paraventricular nucleus. And this is important, because then actually you know that if you see oxytocin being released or if levels are raised, it's actually most often from these areas that the oxytocin comes. Other substances are more complex and perhaps, produced in many different areas. But when it comes to oxytocin, you can be pretty sure when you see a high level, it's because the secretion has been increased from these two nuclei. Now, oxytocin is also produced not only in these nerves that go down to the posterior pituitary. We also have a lot of neurons that enter the brain. I'll talk more about them later on. So this is a combination actually of a hormonal and a nerve activity. And not only that, if you look at the individual neurons that produce oxytocin, well, they are like nerves, because they have the cell bodies in the magnocellular cells of the, say, supraoptic, and long axons transport the oxytocin to the posterior pituitary, and then it's released into the blood. But in addition, oxytocin is also released actually from the cell body and the dendrites. I mean, that is the incoming part of the neurons. That means that you can have very high levels of oxytocin in the brain at the same time as you have a release of oxytocin into the circulation. This sort of, release from the dendrites, it's a very old type of release. It's the paracrine release, where you influence local structures by releasing a substance. Now, I told you that from the paraventricular nucleus, you do have a lot of neurons that sort of project to different areas in the brain. This is one way of showing it. This is the rat brain, but the limbic system and the lower brain areas. But you can see that there are many different areas which are reached by these oxytocin-containing nerves. But I would already like to tell you that within the PVN, you also have CRF, which is the regulating substance of the HPA axis, but it is also produced in nerves, which also project to most of these areas. So you have the two substances, the stress substance and the anti-stress substance, being released, in parallel to a lot of areas involved in important basic mechanisms like autonomic nervous tone and the HPA axis. So if we just summarize what we have in the supraoptic nucleus, you have these magnocellular neurons that produce oxytocin and vasopressin, and they are being released down to the posterior pituitary and into the circulation to act as hormones. But it's recently been shown that some of these oxytocin neurons also send sort of nervous extensions, and they can reach many other areas in the brain, like the cortex or the amygdala and things. So these neurons that you originally thought were only sort of linked to hormone release are also able to influence brain function. And then, of course, we have the paraventricular nucleus, which is then also producing oxytocin, but it has two types of cells, the magnocellular cells that send oxytocin and vasopressin down to the posterior pituitary. But then we also have parvocellular, small neurons. And these neurons are actually the ones that produce not only oxytocin and vasopressin, oxytocin, they also produce CRF, which is the controlling system of the stress system, and TRH, which actually controls the function of the thyroid. And these all nerves from these three different cell types all also go to the anterior pituitary and release the substances into the circulation there to reach hormone producing cells. So it's not just the CRF that does that. And then in addition, we have long fibers of oxytocin, CRF, and possibly vasopressin that can reach very, very distant areas in the brain. And this is actually a summary of the different goals, I would say, for the oxytocin neurons. So if you look at the hypothalamus oxytocin here, you have oxytocin fibers that actually go to the brainstem and to the spinal cord. There are neurons that go along the spinal cord to the very end, where they influence the function of the parasympathetic ganglia that influence the uterus. There are also fibers that go along the dorsal column, which modulate pain function. And then we have oxytocin fibers going to the periaqueductal gray. It's a very important center for regulation of some types of fear responses, but it also is an enormous pain regulatory center. And there, oxytocin acts by increasing opioid function. And then we have fibers to the serotonin-producing neurons in the Raphe nuclei. And we have oxytocin fibers to the hippocampus involved in memory and also some, well, let's keep memory. And we have to the cortex, we have to the basal ganglia, which is striatum, and we have, it influences dopamine secretion, and we have the amygdala. So you can see here what an enormous network of oxytocin fibers we have from the hypothalamus. And that means that all aspects of the stress responses can be influenced by oxytocin. Interestingly then, released always from the same area in the brain. So we have hormonal effects, we have neurotransmitter effects of oxytocin. Now recently, it's been shown that there is always or often a local production of oxytocin also in the periphery. And that means that we have, production of oxytocin in the heart, but we have in the GI tract, but that oxytocin mainly is linked to that kind of paracrine local actions that I spoke of before. Now, what does oxytocin do? Well, we have the old-fashioned classical effects, uterus and mammary gland, which is actually stimulation of muscles, of smooth muscles. Now, I think one of the most famous ways or actions of oxytocin is that it promotes social interaction, bonding, attachment between individuals. But what we are going to dwell on today is that it actually has an enormous effect on decreasing anxiety, stress, pain, and inflammation. And it can then create the opposite. It can promote relaxation, calm, and well-being actively. And actually, it can also directly promote processes that are related to healing, cell division, and restoration and growth. Now, the three last ones here are very often forgotten, and you sort of concentrate on number 1 and number 2. So when it stimulates social interaction, I think this is very, very important, because social interaction is really a complex series of events, irrespective of being a mother and a baby or 2 adults or whatever. It very often starts with an intention for interaction, which starts with eye gaze, touch, and that is leading to oxytocin release, which I will discuss later on, which in turn will lead to well-being, calm, and interaction. So actually, the oxytocin involved in increased social action has nothing to do with the oxytocin that is linked to calming effects or to pain relieving effects or to anti-stress effects. It's a different part of the paraventricular nucleus that causes this. So there are sort of components of the oxytocin system that are activated in different situations. And just a very sort of quick summary of what oxytocin is doing. We know that it has these anti-stress effects, but it's actually anxiolytic. So by giving oxytocin, you decrease the anxiety. It's like a sedative, or it's like diazepam or these drugs. You become a little bit more brave, want to do things. So it's not only about social interaction, it's actually by interaction with other things. I think we've got stuck with social interaction. It's actually a broader anxiolytic action that oxytocin has. And then it has all these, as I said, stress relieving effects. It dampens pain threshold, but at the same time, it increases the activity in the GI tract. It increases absorption, it increases metabolism, puts it and shifts it into an anabolic direction. So we really have the opposite of the fight-flight response in every way here. So just before I start, I will tell you now that the oxytocin from the PVN, I will show you some example, will actually decrease the activity of the HPA axis. It decreases the activity in the amygdala, which is the input of stress reactions, decreases activity in the sympathetic nervous system, and there is a study showing that it decreases the changes to activity in the glucocorticoid receptors. And there is a very, very substantial increase or decrease of the activity in the noradrenergic system via enhanced alpha-2 adrenoceptor function. And when I look at this, and I'll talk more about that later on, I think that by looking at effects of oxytocin, I'm not sure it's the oxytocin receptor you should look for. It might be the secondary effects where oxytocin has sort of caused a secondary effect on the function of all these different anti-stress effects. So just look at this picture I showed to show the activity of the HPA axis. Actually, oxytocin will inhibit CRF. It will inhibit ACTH release from the pituitary gland, and it will also, by local effects in the adrenals, decrease the secretion of cortisol, probably through release from the parasympathetic nerves. So there is, as you see, it attacks all of the different steps in the HPA axis. Or you can show it like this, that if you have an ongoing oxytocin release, you are going to have a decreasing effect on all these steps in the HPA axis. And of course, then, it's very difficult to say where the effect is because it's sort of acting simultaneously at so many of these effects. Now, in addition, there is a very interesting effect within the paraventricular nucleus. I told you we have CRF neurons there, which then regulate the stress axis. And we also have the OT, oxytocin neurons, that sort of is the mother of, I would say, all the oxytocin neurons. Now, in the PVN, there is a very interesting interaction between these two regulatory substances. Actually, oxytocin has a very important decreasing effect on the CRF neurons. And this is exerted because small oxytocin extensions into the periphery act on GABA neurons, which in turn then decrease the activity of the CRF neurons. So that pathway is very, very well demonstrated. So it's not just the HPA axis, there is a direct effect in the PVN where oxytocin inhibits the effect of CRF. So This is just to make the picture more easy to understand. And that is, the more oxytocin we have, the less will the activity in the CRF system be. That means a lot of different aspects of the oxytocin, of this, of the stress axis is going to be diminished. So the more you stimulate the oxytocin system, the less CRF there is. And of course, yeah, it's also true. If you have a very high level in the stress system, that's not good for the oxytocin system. So it's really a balance in both directions. So it depends what type of stimuli you use. There are some stimuli that directly enhances oxytocin release, and I can come back to that a little bit later. Now, I also told you that we have the autonomic nervous system, which is the other aspect of the stress system. The stress system was actually consisting of the HPA axis, and in addition, the autonomic nervous system. And the HPA axis, the activity was blocked by oxytocin at all these levels, in the hypothalamus, in the PVN, in the ACTH, and down in the adrenal glands. And this is then just showing that we have the autonomic nervous system, and oxytocin actually has a very, very important, these nerves, being released from, or being going from the paraventricular nucleus. They have a very, very important connection with the locus coeruleus, where they inhibit the activity of, or decrease noradrenaline release. They go to the vagal nuclei, to the NTS and DMX, and there they are excitatory, of course. And they go and they release oxytocin into the pituitary, I said, to modulate the HPA axis. There they decrease. And there are fibers to the sympathetic preganglionic neurons, and to this area RVLN, which is part of the sympathetic nervous system and very important for blood pressure regulation. Now, what this picture also shows is that at the same time, from the PVN, we have CRF-containing nerve fibers. And this has very often been forgotten, that we have these projections. I think we also sometimes have vasopressin fibers, but they are not so well demonstrated. So you can see that all of these areas can be influenced by either stress or the oxytocin system. So this means that the end product is actually going to be a balance between, how much stress is there and how much oxytocin is there. And in this way, there will be, if there is a lot of oxytocin, there will be a shift from sympathetic towards more parasympathetic tone. And the opposite, of course, if we have a high stress level, there is more, sympathetic and less parasympathetic nervous tone. So this is, I think, a piece of the puzzle that is not really so well known, that we have this system inside the hypothalamus, in the PVN, which had this potential for sort of pushing back or forward between stress and anti-stress. Now, the locus coeruleus, Mechtil mentioned this, very important, very often forgotten structure in the brainstem. And this is actually the origin of most noradrenergic fibers in the brain. And the noradrenergic fibers reach, I would say, all areas in the brain. It's important for all aspects of fight or flight, but it's also important for activity. It's important for concentration and focusing. It's extremely basal. It's important for life, not only for stress. Now, but if we look at it from our perspective now, it actually has a very important role because it activates and reinforces the activity in the sympathetic nervous system. And then, of course, as soon as you inhibit the effect in the locus coeruleus, they're going to have an indirect effect on the sympathetic nervous system too, by oxytocin. And then you have this interesting, which you could see this in this picture, Mechtil, that you showed, that we could say we have two stress systems. We have the CRF system, which is the hypothalamic stress system, which is mainly the HPA axis, and a little bit the autonomic nervous system. And then we have the brainstem system with the lucus coeruleus, which is the noradrenergic system, which is in a way differently activated, but they are in communication. So when you have high CRF levels, you will have an important input to the lucus coeruleus, and you will increase the effect of the lucus coeruleus. And when you have high CRF levels in the you will also have a high level of CRF release in the amygdala. So you have an input and both an efferent and an afferent activity of the CRF neurons. Now, what then is the mechanism behind the effect of oxytocin on the noradrenergic system? Well, I think you all know that we have different types of adrenoceptors, that is the receptors for the adrenergic system. We have alpha 1, we have alpha 2, beta 1 and beta 2. And I guess you all know that we take beta blockers if we have too much the heart rate is too fast. So there are different, the population of these receptors differs. But the alpha 2 receptors are very often located on the neurons, on the noradrenergic neurons, and they are inhibitory. It's sort of a self-inhibitory system. Sometimes they are also postsynaptic, and they are also then decreasing the activity. But consequences of alpha 2 receptors is actually decreased arousal, vigilance, and aggression, lowered activity in the HPA axis, lowered activity in the sympathadrenal system, and increased vagal nerve activity. So by modulating the activity of these receptors, you can sort of shape the basic function of this noradrenergic system. And it happens that giving oxytocin is one of the best way of decreasing the sensitivity of this noradrenergic system. Now, this is complex because this is pharmacology. Clonidine is actually a drug that activates alpha adrenoceptors. And you have, and actually, if you have given oxytocin, you get a much better, these spikes are the firing rate in the lucus coeruleus. So with oxytocin, there are less spikes in response to stimulation. So in this case, we have stimulated, with these electrodes inside cells in the lucus coeruleus. And if you have treated the individual with oxytocin, you can see that the clonidine is much, much more active. You need much more clonidine to do something here, to decrease the activity if you have not received oxytocin. So, and that will impact all the areas in the brain. And so we have this phenomenal activity of oxytocin by decreasing noradrenergic tone, in addition to decreasing the CRF capacity in the HPA axis. And again, it's enough if you decrease these functions by 10 or 20%, because altogether the effect is going to be enormous, because there are these feedbacks all the time, the positive feed forward within these systems. Now, and there is another aspect of oxytocin that I would like to mention, and that we've seen, Jonathan, in that paper on cortisol, the effect of oxytocin on cortisol, on the glucocorticoid receptor. And that is that if you give oxytocin repeatedly, that something happens, because you get into long-term effects. Effects become, normally, if you give oxytocin, you have an effect, say, for half an hour or 3 hours or something. But if you give it repeatedly, you get into effects that last perhaps for weeks after the last administration. And that means that something more happens to the receptors than just being sort of activated by the oxytocin. This is just an example where you can see how blood pressure is influenced by oxytocin. If you give oxytocin 5 times before 0 here, and then you look at blood pressure, you can see after 5 days it's fallen, but then you don't give any more oxytocin, and it's not back in this case until after, say in this week, there is perhaps 1 week. And this is an effect in the brain because it's given ICV, and in the saline controls, nothing happens. So there is something with oxytocin that triggers 2 functions, one immediate and one secondary. And it seems very often that if you get into this secondary effect, you can't block it with oxytocin antagonists anymore. It seems as you have actually increased the function of the secondary receptor, like an alpha-2 receptor or opioid activity. So it's this, I think there are 2 waves of oxytocin effects, and these are of course extremely difficult to understand, that they are oxytocin mediated, because when people look at the receptor function, you don't see anything on the oxytocin receptor because it's been transmitted to this secondary function where the activity is the long-lasting one. Now, this is just to show how important I think oxytocin could be, and why I think it is important in the long term also. In this case, we had given, or we had created stressed rats by starving them during pregnancy. And then the offspring, as we have discussed all the time here, are born with higher blood pressure and higher cortisol levels than the ones that are born from mothers who were sort of reared under normal conditions. And then what we see then is if we give oxytocin in injections to the pups 5 times, directly after birth, which is the normal route of administration that we use, you actually normalize more or less blood pressure and the corticosterone levels in the rats, and they remain normal for life. So something happens early in life with oxytocin. If it's somehow the acute effect of oxytocin is somehow transferred into a long-term effect. And I'm not sure it is linked to an increased amount of oxytocin receptors. But we do have a lot of data showing that they have many more alpha-2 adrenoceptors, these animals that were treated with oxytocin after birth. So I think this is perhaps one mechanism by which oxytocin could cause important long-lasting effects. And this is, of course, the paper I was mentioning that I have been discussing with Jonathan, is that we also have a decreased, we modulate glucocorticoid receptors in the hippocampus in a way that is also consistent, with decreased stress levels, because these, the glucocorticoid system in the hippocampus is actually inhibitory. So it depends a little bit where you look, what effect you should look at. So this is one of these many effects. But this is not enough, because there is another way by which oxytocin works, and that is by actually influencing the amygdala. The amygdala, well, all that, is a very important sort of site for the recognition of stress levels. If something happens, we have you have impulses from the cortex to the amygdala, and the amygdala gets activated. And one of the very important effects of activation of the amygdala is a CRF it is actually from the amygdala. You have these very important activation, I would say, of the CRF system in the lucus coeruleus. So there are CRF nerves that go to the lucus coeruleus and activate the amygdala. No, and activate the locus coeruleus, which in turn activates the CRF neurons in the HPA axis. Now, if you at the same time activate the oxytocin system by sensory stimulation or whatever, you will have a decreased activity in the amygdala. So oxytocin fibers project to the amygdala, and in the amygdala, they sort of decrease the sensitivity of the amygdala for these external impulses. So not only does oxytocin sort of decrease the activity of stress inside the brain, it also has this decreasing effect on the incoming impulses by reducing the sensitivity of the amygdala. Now, I have to say one thing, of course, and that is that we all know that oxytocin doesn't act perfectly in all situations. If the situation is terribly stressful, the stress system will always win. But there are also situations where the stress activity is not so enormous, and then we will have very clear oxytocin effects. So stress can inhibit the activity of the oxytocin system, but if it's not too bad, it doesn't. So, but this is a very clever arrangement, and I will show you later on why I think birth and labor are so important and why we have this effect being extremely important in this situation. So summarize, and also it's not only that, oxytocin can also, change the type of responses that we get from the amygdala. So you get less severe stress responses. And there are also effects in studies now showing that it sort of easier turns, I would say, stress-related stimuli into, condition, not less habituated stimuli. You're not so afraid of it. So it helps the organism to adapt to the environment by reducing the intensity of stressors. So this is now to show you again how we have all these different effects of oxytocin acting at the same time. I think this is one of the reasons this system hasn't been understood, because it's not a one-to-one thing. It is this network of effects that sort of turn the stress system towards a non-stress or anti-stress pattern. Now, why do I mention these factors? Well, I think there is one way, you see, by which you can directly stimulate the oxytocin and not stimulate the stress system. There are some mechanisms or some stresses or situations where both oxytocin and stress are activated, but there are some situations where you can selectively activate oxytocin release, which will then have these positive effects. And this is actually from the skin, because in the skin we have two types of sensory nerves. We have the noxious nerves, which actually mediate pain, and we have non-noxious nerves, which mediate pleasant stimulation. And of course, we are talking about the non-noxious nerves now. Now, this is actually how I got hold of this the first time. I was spending some time in Tokyo in a lab, and they were looking at a rat model. They were sleeping rats, and they were pinching the foot of this sleeping rat, and then they were measuring cortisol levels in the blood. And you can see, of course, how cortisol levels rise immediately after this pinching. And remember, in these sleeping rats, so it's not a conscious fear or anything, it's a sensory stimulation from the foot. But what was obvious, if you know, we made some control experiments where we used a toothbrush, just brushing the foot as a control. But what you see is that cortisol levels fall. And that's why we started to think that oxytocin might be released by the low frequencies. This is just to show with low intensity, you lower blood pressure. You get all these anti-stress effects by low intensity stimulation of nerves from the skin. Now, look at this. This is just to show you, where do we have sensory nerves? Well, we have nerves from the stomach, we have from the female genital tract, the pelvic nerve in particular, and we have from the mammary glands, and we have from the face, and we have everywhere in the body, for example, the sciatic nerve in the body. And as I see it, at least, I think one of the most important inputs to the oxytocin system is the sensory nerves. It's the parasympathetic system from the inner organs, but when it comes to the skin, it's of course the non-noxious fibers of the cutaneous nerves. And this is some very, very old experiments where we stimulated some skin nerves, I think it was sciatic nerve, with very, very low intensity, and you could see how the oxytocin levels rose depending on these stimuli applied. Now, if you then start to stimulate with higher intensities, you get cortisol also, but you don't get that with these low intensities. So this is a selective stimulation, low intensity of the oxytocin system, and this is the interesting thing. And you can also discuss this more, it's more and more clear how these nerves are going up to the brain. And the interesting thing you see is that the cutaneous sensory afferents, they have their ganglia in the dorsal root of the spinal cord, and then you have one or possibly no connection, and then you have nerves going up to the thalamus and the somatosensory cortex. But before they go to the cortex, they send these axon collaterals to the hypothalamus. And what happens in the hypothalamus? Well, you can look at this one. Low intensity sensory stimulation. You will have these axon collaterals activating oxytocin neurons. And what do you get? You get oxytocin activity in all these small neurons that increase parasympathetic tone, decrease fight, flight, fear, pain, and all these things. So by selective stimulation of the somatosensory afferents that are only mediate the impulses that are of very, very low intensity, which corresponds to stroking, to light touch, light pressure. I think it's important to remember that warmth is very important too. You don't get any good effects by touching with cold hands. It has to be within a pleasant temperature. You can really change the balance between the stress and the anti-stress system by adding touch, because you have this direct connection to the oxytocin system. Now, how is this important in our sort of context? Well, I think oxytocin is important in female reproduction in pregnancy. It's more activated. We have a lot of elevation of the oxytocin system, but it's mainly related to estrogens. But we also have a lot of oxytocin during labor and birth, during skin-to-skin contact, and during breastfeeding. And then, of course, if you look at the effects that oxytocin cause in these situations, well, of course, we know that during labor, oxytocin is going to contract muscles to promote labor, birth, and milk ejection. But actually, in all these different situations, there are studies showing how oxytocin facilitates social interaction, stimulates attachment and bonding. It's sort of already being primed, and it decreases fear, pain, and stress levels. And it stimulates processes related to restoration and growth. And you can see this in experiments because these effects are stronger, for example, in mothers having had a normal birth than a cesarean section, because you need activation of all these systems. So this is the more general kind of effect. This is the effects caused from the paraventricular nucleus, from the neurons there, not from the hormonal actions of oxytocin, which is more than milk ejection and getting the baby out. And so this is then the estrogen, of course, and this is then, we have this intense stimulation of the Ferguson reflex. It's not just pain. And we have the skin-to-skin contact, which is the perfect stimulator of the cutaneous sensory nerves, the low-intensity stimulation. And actually, if we look at this situation, we know that if the babies are allowed skin-to-skin just after birth, there are long-term oxytocin-related effects. And so 2 hours of skin-to-skin after birth causes, you can read this after 1 year and sometimes later, you can see effects of more social, I would say, abilities, and also a lowered stress reaction or lower response to stress. So I think this is another of these, Jonathan, biological windows where you really influence things, and that is in connection with birth. Because, as you say, the babies should be learning what's the surrounding like. And if it's a pleasant, warm, touching surrounding, they increase the activity in the anti-stress system because they think this is going to be life and they adapt. Whereas if they don't have the skin-to-skin, they don't get this extra ammunition for the oxytocin system, and instead they have a higher stress reactivity. And what about breastfeeding? Well, breastfeeding is also, each time a woman is breastfeeding, her blood pressure goes down and the cortisol levels go down because she is activating this paraventricular nucleus. And she has also increases the function in the vagus. So that is really a very meaningful adaptation each time a woman is breastfeeding. But from this perspective, I mean, from the perspective of long-term effects and also of the perspective of oxytocin somehow being involved in long-term effects, be it directly or indirectly, I don't know. Actually, if you look at the literature, you will find where you measure the risk of disease in women, you will find that if you take women of 50 and 60 or even older and look for the risk of developing cardiovascular disease, you will find that, okay, it's no good to be overweight, it's no good to be smoking, it's no good to be stressed, nothing. But it is good to have breastfed. So the more babies and the longer time you have breastfed, the less is the likelihood of developing exactly those diseases that we have spoken of, diabetes type 2, and of course, stroke, heart infarction, and hypertension. So it's always this pattern of effects that you see. But in this case, what these women have been sort of exposed to is an enormous exposure to oxytocin many, many times a day, sometimes for many years. And of course, these long-term effects may be so intense that they continue to sort of survive for this period of time. And of course, I would just like to stop with a picture here on labor, because actually we forget that during labor, we have an intense information cascade coming from the uterus all the time, which is mediated by nerves. So if we have, contractions, pain, reduced blood flow, too little oxygen, whatever, in the uterus, that is going to be an activation in the sympathetic afferent nerves, which will result in pain and in stress reactions, more vasopressin, CRF, whatever. But also, if you have, on the other hand, more moderate contractions, the parasympathetic nerves are going to win. That is the Ferguson reflex. And this is actually then, during any labor, it's going to be, the balance between these two that is going to be of importance for the experience of stress and pain for the woman. One of the important factors. But the other thing that is important here is, of course, that if you don't have it at all, you will lose the ability you may not have so much pain, but you will lose the ability not only for pain relief, but also for the amnesia caused by oxytocin. And then what should be remembered, and what I spoke about just a minute ago, that you can add to the force in this axis by cutaneous stimulation support, and probably the mental equivalence, being very warm, understanding, and supporting. Then you will increase the function in this aspect, more and more oxytocin, which will reduce the activity in the stress system. And of course, in the long run, also, there is a reduction of the memories of the bad things that happen, and perhaps also a diminished risk of developing trauma in connection with birth. So thank you very much. This is what I try to say. And what I really have said is that there is no difference in this story from the ones that Mechthild and Jonathan has given us. It's just that there is an unseen, I would say, co-player, the oxytocin system, which does the opposite all the time, and which has its specific activators, which are within the, which in the low grade of intensity. And I think we have in our civilization forgotten how active silence and low calmness and touch can be, because this is actually the reason and the mechanism by which we change the balance in this possibly good and possibly vicious circle. Okay, thank you.
So, thank you very much, Kerstin. And once again, I'm going to, yes, we have questions. I'll take the microphone round.
Thank you very much for your presentation. I was wondering what's the effect size of, so you talk about the predictive role of skin-to-skin contact early after childbirth on oxytocin production, if I correctly understood. And I was wondering what was the effect size?
I think it depends. It depends on the duration of the skin-to-skin contact. It depends on the level of stress that, it has to balance out, of course. But what I'm saying is that it's not only, I think there might be a very strong effect of the oxytocin being released during these early moments. And that may be transposed into not only a higher oxytocin level during life, but also by a slight change of the function of the stress system at many, many levels. You see, if you remember all these different nerves going to the sympathetic and going to the, so it may be that it decreases the reactivity by perhaps increasing the number of alpha-2 receptors versus alpha-1 receptors in the noradrenergic system, but also perhaps decreasing somehow the function of the CRF system a little bit. I don't think it's oxytocin levels per se that continue to be high. I think it's the system that it is there, and it's still more easy to activate in those who have been sort of exposed to early skin-to-skin talk. But I think the effects are on the secondary sides because of this two-wave effect that oxytocin has, the oxytocin receptor, but then it transforms into the effect in the secondary sort of receptor sites. So I don't think you can so easily say that it is, but what I would say, it's a higher function in the oxytocin system, which then involves the whole network of effects and the consequences.
Yeah, so I think it's not very clear to me to what extent, maybe I try to formulate my question in other ways. What could we reply to parents that are worried that they didn't do skin-to-skin contact with their infant?
That's a good question. Well, what they can do is, what they can do, there is a very nice study by Anne Bigelow, and what she did was to take full-term babies, and she gave them extra skin-to-skin contact during a few weeks for an hour a day or something. And they also, and in this situation, she I think the mother's cortisol levels were lowered, and the baby's. So you can always activate the oxytocin system, but
Okay.
it takes longer. It takes longer because there is this biological window immediately after birth when it seems as if the effect that is induced is more intense and more long-lasting.
Okay, thank you. And just a last question: is there a difference if it's is there data showing that if the co-parents make skin-to-skin contact, the effect will be different than if it's the mother, or it just do we have available data on that?
Well, I think there is a quantitative effect, I'm sure. And you know why? Because I know the temperature of the skin is different. The mothers have slightly higher temperature. And even, which is not the topic of this talk, the mothers, after birth, the mother's skin temperature fluctuates, which is probably part of this oxytocin pattern. And we always know in biology that slightly varying levels are more effective. I think the temperature here is very important as a set point for the effects. And the fathers, we know they are also very good at skin to skin and all this, but I think it's a quantitative difference, most certainly, because mothers have been through labor and they have been through pregnancy and are a little bit more primed when it comes to these neuroendocrine networks.
Oh, sorry. Yeah. Okay. Hi. Sorry. She said thanks. I kind of have two questions as well. One, just as a clarification, because you were talking about treatment or giving of oxytocin in some of the studies, and then some of the studies it was more like a stimulation of oxytocin production, because from my understanding, obviously syntocinon would be not having all this complex nervous effect than just oxytocin that is produced. So in the studies, just to clarify that, when you were talking about giving oxytocin,
I was not talking about giving oxytocin one single time here, unless it was animal experiments.
Yeah, okay, I think it was the red one. So is that?
Yeah, that we give, but we give it in very high amounts in order to allow it to penetrate the blood-brain barrier. But I would also like to tell you that the more we look at studies now where we have given, what happens in response to oxytocin infusions, yes, there are some effects anyway, and it seems as if the interaction between mother, if you have relatively low doses of oxytocin, it doesn't seem to be bad at all. But the problem is that if you give high amounts of syntocinon during labor, you get into long periods of, when the uterine muscles are really too much contracted and too little oxygen. And then you have a higher firing in the stress system and in the sympathetic nervous system, which is very bad. But it doesn't seem to be the oxytocin per se. It's the indirect effect through this, I would say, unphysiological balance between relaxation and contraction in the uterus.
Okay, thank you. And then I have one more, and I'm not really sure what kind of question, and it might be for Kerstin and also Mechthild, sorry if you're still there, because I was just wondering, with relation of, we haven't really touched on the breastfeeding in the sense on epigenetics, and I'm not sure if it is more because it's producing oxytocin and that is having an effect, or if there's a nutritional value in that. Sorry, I'm looking at John.
Anybody is actually ever even also looking at this?
Okay, because for me, I don't know, and I'm just putting it out there, but like the Latino effect or the first generation effect that we're having, are those groups that would be more prone to maybe having breastfed? And I'm sorry, I don't mean to be stereotyping or anything, but like it just came to my mind in the first, and I wasn't really sure how to phrase it. So, and then through your presentation, Kerstin, I just feel that might be something that should be looked into.
Actually, there are studies showing that if you breastfeed, you are more likely to resolve your traumas than if you're not breastfeeding. So I think we know there are these nutritional effects, but most likely, I think when people have looked at these things, the cultural background of the people or the women involved is pretty the same, much the same. But I'm sure there are many effects that add up to this. But it's interesting that the effects of oxytocin on breastfeeding on health was dose dependent. That means that the more babies and the longer time, that's at least for a pharmacologist or physiologist like myself, one important piece of which makes data a little bit more convincing than just yes or no.